I'm Jackie. I'm a nurse practitioner. I've been a nurse practitioner for about 13 years. Prior to opening our clinic about 4 years ago, I was doing traditional medicine. So that was my background, my training, and there were a lot of gaps that we saw there. And so now we have a private clinic in Minnesota.
So I'm Tad, I'm a physician assistant. I've been in practice for about 14, 15 years now. A lot of my background has been in trauma surgery, orthopedics, and pediatric orthopedics. But with Flourish, Jackie and I were both practicing in very different realms of medicine. And then Jackie was prompted to start a clinic, a little bit different type of medicine that was more wellness and holistically based compared to more of the traditional medicine that we were both involved in. And she took her idea, took her inspiration, and was able to get the clinic off the ground completely. And we had talked about potentially both of us being at the clinic, not knowing where God would lead. And Jackie, through her diligence, through just continuing to listen to those prompts and treat people the right way, grew the clinic from the ground up. And then a few years later, I was able to come over and join the clinic as well.
The biggest thing, there's a lot in Minnesota, there's a lot of pushback. There's not a lot of, integrative, holistic, more natural medicine clinics there. It's very hospital, like big system based. So that was the hardest part for me, was stepping out of that and kind of having to fight for what I really believed. The results, the clinical outcomes are exponential growth. I mean, now, in 4 years, we have 5 providers, we have an RN, we have a team of about 13 people. So it's grown significantly because of the amazing outcomes. But I would say the hardest part was kind of breaking through and having that confidence of, I am doing something different and it's okay. And this works. And this is something that's, there's a huge need for it, which we've seen by the growth from our patients. Just really that authenticity, being true to what your gut's telling you and what's leading you, and the purpose. The purpose isn't to make money. The purpose isn't to have a big glamorous practice. For us, it's truly just genuinely helping people, helping them and empower them to know what they can do, what they can control, not me telling them what to do. I think that's a big piece. And so just being true to that purpose, that authenticity, and being for people. It's not about us, it's not about me, it's about them. And when you do that, I feel like things kind of take care of themselves. It's not always easy, but they take care of themselves.
Yeah. And we all have a conscience as providers. We can know, you feel it on the inside if you are passionately moving forward with the highest level of ethics to your calling, what you're supposed to be doing. And when you're not, when you can feel like, all right, I'm really having to pump myself up for this. Let's have a good day here. You can feel that, and there's a disconnect there. The other thing too is just being able to, on a daily basis, meet the biggest need in American healthcare right now, which is to empathetically and passionately invest in people. It's not even about the X's and O's anymore, about the knowledge base. That's just the very bottom rung. That's what you have to have. But what people are truly looking for is providers who listen to them and invest in them wholeheartedly. And that's what people feel. That's why people keep coming back. They're saying, holy cow, there's people who actually care about me, not just as a patient, but as a person. And that's the missing link right now, especially when we get into these huge systems of medicine, because they become so automated and so regimented where that gets lost a lot.
And then when you have amazing products like CellCore, that you actually see results on top of that, right? So for us, being trained in that more traditional world, when you have tools in your toolbox like CellCore that move the needle, that you can show your patients before and after, like, here's how it's impacted your labs, here's how it's impacted the different tests that we've done, and they feel better, right? So it's huge. I honestly, CellCore has been pretty much a big part of our practice since we started. And I believe that was kind of a divine intervention, right? Because I was diving into this space that I had no idea about, and God really created that path for us in so many ways. And CellCore was a big part of that, right? Because I went from not having a lot of background and training in that to, wow, this stuff actually works. And I'm helping people more now than I did in my previous 10 years of practice. Not only are their labs looking better, right, but they feel better. Their life is better. Like it's completely different. So there wasn't a whole lot of like prior to CellCore for me. It's just that's been a huge tool, and just it's kind of easy and fail safe to be honest when you're just diving in and you're like, wow, this is super overwhelming, but it's given in a way that it's safe. You can help people, you see the changes, and then as you grow and you become more experienced and more knowledgeable and grow your education, you can really fine tune and tweak things. But you can't not help people with CellCore products because of the world we live in. Like, it's everyone needs it.
And I was, coming from my medical background, I was very skeptical of CellCore, no question. It was something where I was like, show me the results. And then as you see the results over and over again, that's what makes you say, holy cow, this is a whole different way of treating people and talking with people and approaching health than anything in my training. The other piece is just with how we look at health and wellness in our practice is we really marry CellCore in with the major lifestyle pieces. What does nutrition look like? What are your exercise habits? How are you managing stress and emotional health and sleep and grounding and sunlight and all the things that are important from a controllable standpoint? And it fits so well into that where that combination yields incredible results, which is so outside the box for more of that traditional medical training. But it's such a great tool. And the nice part is too, there's so much flexibility within CellCore. It doesn't have to be, fitting people into this one system or box or protocol, because there's so many options, so it can be very specifically targeted to that individual. I try and keep it pretty basic with mitochondria, helping people understand how much does energy play a role in your life. And when you're talking to a single mom or a dad who works a corporate job that's high stress and then wants to coach his son's baseball team, you look at those significant priority areas and say, okay, how does energy play a role? And also, how do you feel when, as a parent, you don't have the energy that you think you should, and you don't have the energy to give into those areas that are most valuable to you? And that's a way to really put great value on energy and our body's ability to produce that in an efficient manner. That's what hits home for people, and that's how we motivate. That's how I motivate people.
As you mentioned, like just the energy, but what is that doing at a cellular level, right? Like that is the energy for our cells, and our cells need that for healing and detox and just basic function and methylation, like all of the things that keep us functioning every day. For me, when I first came to CellCore, and I don't even remember how I was introduced to CellCore, again, going back to that kind of divine, like, I don't know, it just landed in my life. But when I first came to my first eco and just seeing the people, like the genuine, again, authentic people who are for people, it's not a competition. Like that was a big deal for me, knowing that, hey, I'm not just getting involved with a company that can help people, but they're truly for you and they're great people. That has been, if you have a company like that, everything else will take care of itself. So that's been my biggest thing with CellCore, is just all the people are so great.
And you learn so much. I mean, in this community, you have people in terms of things like emotional health that we talked about yesterday and the effects on people physiologically. I mean, we learn stuff every day coming to this conference, and it's different areas that maybe we deal with, some in the practice, but some that are completely outside of what we do on a daily basis that we can really, maybe take little bits and pieces from. It's an incredible group of people.